Hey there, Dr. Taylor, Aspire Chiropractic. Today, I want to cover a topic that's brought up pretty routinely. Somebody comes into the office, they go through a treatment of care, or heck, maybe they're just 2 or 3 visits in. Hey, Dr. Taylor, I just had a baby, or my wife is pregnant. How soon can we bring the baby in? Or, Dr. Taylor, I've gone through care, I came into you with this neck pain or this debilitating back pain or these headaches, and man, after getting adjusted regularly, I feel amazing. But my mom or my dad, they suffer from the same kind of thing. Or they got this hunch in their back, because they're getting old. Can I bring them in? Can you help them? Because mom, she's in her 90s. Answer the question on both accounts and even everything in between. Absolutely. Chiropractic is great. From 0, well up over 100 years old. You know why? Because we all have spines, right? The youngest person I've ever adjusted, been 5 minutes old, is my son. I actually adjusted him in the delivery room. Prior to him, it was my daughter, but for her, we waited until we got back to the hospital room. For my son, we adjusted him right there. Oldest patient I ever had was 101. She come into me, she got low back pain, and she was rolling herself in on a little silver walker that she named Trigger, right? From like the Lone Ranger. And like I said, and everyone in between. Now, with situations like this, there's certainly special considerations that we apply to an infant or that we apply to elderly, things like that. Because obviously with an infant, somebody 0 years old, what was delivery like? Was it a C-section? Was it a vaginal birth? Did they use forceps? Did they grab the kid by the head? Was he breech or she? There's these things that we have to contend with. What was it like post-delivery? How are they nursing? Are they favoring a side, left or right? Are they nursing? Are they bottle fed? A lot of times we'll see with kids, if they're favoring a side while nursing, they might have an issue in the neck. Because a kid can't tell you, or an infant can't tell you, hey, it hurts to turn my head to the left. So what are they going to do? They're just going to feed on the right. Opposite end of the spectrum, 101, right? Largest concern? Osteoporosis, okay? Our bones get brittle. They get weak as we age. Other concerns, do we have that hunchback? Are we using a walker? Are we ambulatory? Or do we spend most of our time in a wheelchair? Are we active? Are we up and about? Are we moving? Obviously, what sort of medications are we on? Ideally, there's not going to be medications anywhere along here, but you're certainly more apt to take them when you get up in age. And they can also have certain side effects. They can exacerbate things like osteoporosis. Obviously, if we live long enough, fun fact, we're going to get arthritis. Where is it? Okay, so not really applicable to an infant, but certainly to anyone who's getting up there in age. We're going to take an x-ray, right? We need to see exactly what we're working on. We have any sort of degeneration? What do our discs look like? Because 101, there's a lot of bone. In an infant, there's not a whole lot. Okay, a lot of our bones when we come out aren't even ossified yet. They're not even hard. They're just flexible cartilage tubes, right? Think of like a sapling or like a young tree, a green stick, if you will. So, we got the infant, we've got the elderly, and we've got everybody in between that we can help here at Aspire Chiropractic. Because basically, if you've got a spine, you've got issues that can arise, right? Because we all bend, we all move and twist and go throughout life like that. So yeah, you know anybody that's an infant, you know anybody that's 101, or if you know anybody between those ages, we'll help them anytime they walk through that door. Here at Aspire Chiropractic, we're ready to help you when you're ready to be your best, naturally.